that's just my style of speaking, so bear with me a little bit. So today I've been asked to speak on the top 10 deficiencies and to sort of focus a little bit on the top 2, which included generator and infection control based on last year's fun time we had. And before I start, I want to say to all of you, I recognize some of you in the room, some I don't, but I want to just say how much we appreciate that you've been there with the residents. And I, as a nurse, I appreciate your efforts. I want to thank you for your efforts. And it looks like we're still not out of the woods yet, so everybody's just got to keep working together as a team. We'll get through this, but thank you very much. So with that being said, let's get started. I've been with the agency for over 10 years, and just for those of you who know me or don't know me, as I said, I'm a registered nurse. I go in to do surveys as well as unlicensed ALFs. So I have a different combination of background, but that's a little bit about me. So the objectives today are to review the agency's statistics and responsibilities, to review the most frequently cited ALF deficiencies, and to discuss the top findings from focused infection control surveys. Gentlemen in the back, there are chairs if you want to get a chair and sit. So bad that you're the back of the room. There are some chairs. There's one right here. And I think there's another one back there. You can come and get them if you want. So these are some of the trends for A200 and A30. So for A200 and A30, they've increased their ranking in the list over the past 8 months due to the generator infection control surveys that we've been doing. And I'm sure most of you have had either one of those or both, and maybe frequently. So between September 2020 and April of this year, our staff completed 16,682 generator visits in the ALFs. That's quite a bit, right? And in between the same period of time, we also completed 2,719 infection control surveys, monitoring surveys. So we were busy with you, just sort of see how we can work together. And that was a lot of focus last year. We weren't doing the relicensure surveys. We were focusing on the infection control. So with that being said, the numbers you're going to see for what we were citing did change, but some didn't, which was interesting. So some of the people in the back may not be able to see this, but I'm going to run through it so you can get an idea. So for the calendar year 2020, the top number 1 citation was A30, and that's resident care, resident rights, and that was cited 375 times. Now, in 2019, that was listed as number 4. We only cited that 367. So you can see the focus was on infection control, which obviously we were all in it. The next, second one was A78, which is staffing standards, and that was cited 266 times. Staffing standards was number 3 in 2019. So that stayed, within the same, give or take 1 or 2. The third was A200, I keep saying 200. That was the emergency environmental control. And in 2020, we cited that 235 times. In 2019, it was number 1, and we cited it 615. So it has decreased. I don't know if it was because of the pandemic that we weren't focusing on that until we got started again in September, and we're starting to see more of that. But that was an interesting statistic, I thought. Number 4 was A81, which is training, staff in services, and we cited that at 221. And that was actually 2019, number 2. The 5th spot for 2020 was resident care supervision, or A25. And that was cited 187 times. I will say that the citations, many of them, we've seen an increase in elopements from memory care units. Patients, residents that are, have had a change in behaviors, and either they're not being assessed, or they're just, responding to the pandemic. So just be aware of that the elopement, especially with memory care units, we've seen an increase across the state. Number 6 is A52, which is the medication assistance with self-administration of medication, and that came in at 150 citations for last year. A162, which is resident records, that was cited 145 times. That was listed as number 5 last year in 2019, 2 years ago. So that, that was significant. And then we have Z816, which is the background screening, the attestation, which was 143. The background screening clearinghouse, which is A14, is 139, excuse me. And the last top 10 is A84, which is training, and that was cited 118 times. So you can see for last year, the focus really was on the infection control, your staff training, because you probably had new people coming, and the generator, because we weren't out there doing the full relicensure surveys.
Yeah, what
Yes.
was 8 and 9? They kind of ran together, so I missed it.
8 was 816. That was background screening, attestation, and that was 143 citations.
Number 9 was 143.
Number 9 was 814. That was the clearinghouse,
Fair enough.
and that was 139.
Okay, thank you.
You're welcome. So I'm going to go over just sort of decided to pick a few of them, not to go through every single thing, but to sort of do highlights. And we're going to start with A200, and that, this is the EECP, which each facility, as you know, has to prepare a detailed plan to serve as the supplement to your CEMP, and it has to address the environmental control in the event of a loss of primary power. So we are all familiar with that. So some of the reasons that we found that people were being cited for this were they had no comprehensive emergency plan to begin with, which sort of makes me wonder. But with the pandemic, it could be a lot of different things, like the counties weren't available to provide that approval. And then no approved emergency environmental control plan at all. No policies and procedures for a cooling plan. And the lack of notice to residents or the representative regarding the EECP. So that's pretty straightforward. I mean, it's some other reasons for citations. We found that the generator inspections or the testing was not done as required for safe functioning. There's a lack of staff training to operate the equipment. People may have resigned. They weren't their normal staff, so the staff that were there, they may not know how to run the generator. And lack of fuel, less than 48 hours, and no fuel available for the generator. So we're in the middle of hurricane season, so I'm hoping that everybody in this room everybody's on top of this. So if we're in there, and we're not going to get these citations. So the next area, which I thought was interesting, was the staff standard, and this one has been in the top 5 deficiencies for the last 2 years. And this, begins within 30 days of employment. Newly hired staff must submit a written statement from the healthcare provider documenting that the individual doesn't have any signs and symptoms of a communicable disease. Well, obviously is very important with COVID this year, and moving forward again. So we want to make sure that that's being done, as well as the evidence that the individual, your employees, have a negative TB examination. We need to make sure, remember to do that annually. We sort of focused so much on COVID that we lost track of some of the other things that are expected. So the next is A81, and that's the staff training. Again, this is another one that was in the top 5 for both 2019 and 2020. And this is talks about the staff that provide the direct care to residents or other nurses, assistants, or home health aides. They must receive a minimum of 1 hour training in infection control, which includes universal precautions and facility sanitation procedures, and the facility must use its own infection control policies and procedures when offering the training. So along with this, there are other things to be considered as well, that when you have an employee that's hired within 30 days, you want to make sure that they're receiving their 1 hour of training prior to taking care of patients. 2 hours prior. And you also want to make sure that they have their 1 hour of training that includes, reporting abuse and neglect and exploitation, as well as, adverse incidents. And as well as having the staff within 30 days of hire demonstrate an understanding and competency with the elopement policy. And that is an important topic because of what I just told you, that we're seeing residents in memory care that are eloping, and the staff are not familiar with what the policies are for that facility. So that's something to be considered as well.
I have a question.
Yes.
That particular training, can you use the software like Relias, and that can count as the RH training?
I'm not familiar with what you're asking.
For 1 hour of training before somebody's hired.
Right.
So we have like infection control, Alzheimer's, and we use that as part of their training. That is something they have to do in our facility before they can start. Does that count as?
As long as you're meeting the minimum requirements, that they're getting that, you're including the things they need to know, as well as whatever else you want to include. It's the key, I believe, is that they must have an understanding of what your policies are.
Okay.
So if the surveyor comes in and if I ask a question, it's not that they're, they don't look at me like, I don't know what you're talking about. They have some kind, they may not be able to tell me verbatim what it says, every little thing, but at least they know where they can go ask, or where they can go look, or that kind of thing. So, under resident rights, this is A30, and this is where I'm going to spend a little bit of more time today. The facility must have a written statement of its house rules and procedures. It's included in the admission packet. And the rules and procedures must, at a minimum, address the facility's policies regarding infection control, sanitation, and universal precautions. So, I'm not going to tell you how, everybody has their own way. And as long as you show me what you have, this is meeting this. So if you're telling me your policies do this, this, and this, and your staff knows about that, and that's the requirement. I think we get bogged down with, it has to be a specific structure. It's not. It specifically says the facility's policies. So here's some of the reasons that surveyors cited last year for A30. Failure to perform hand hygiene, failure to utilize PPE appropriately, failure to follow current CDC guidance for visitation, and failure to follow CDC or state guidance for staff testing for COVID-19, and failure to follow the facility infection control policies and procedures. And this is, this is gonna carries on again to this year, so just looking at the same. What are we looking for in the survey process? This is basic. I consider this basic. Our staff cleaning and disinfecting frequently touched surfaces and shared resident care equipment. This is basic infection control. Our healthcare providers wearing face masks while in the facility. Do they wear the PPE appropriately? One of the things I'm going to get on my soapbox, and when I see these masks where people are doing, they've got the mask on, and they've got the mask down here, or they've got the mask up here, or they've got the mask hanging here, or they've got the mask looped on their arm and it's flying. But my biggest pet peeve is when I see people constantly touching with their hands the mask. Because what is the dirtiest part of the mask?
Outside.
The front, right? So please, I know we're so tired of this, but it's important that we educate your staff. If they're touching the mask, touch it by the loops, keep your hands away from their face. Don't keep touching, not sanitizing your hands. So that's my little speech for the mask, but masks are not going away. So just remind them, if you're manipulating your mask, you need to wash your hands or sanitize your hands. When you're done touching it, re-sanitize or wash your hands. Because the whole point is the germs are on this.
So, Ann, has the agency formed a perspective on if the facility's fully vaccinated? Everybody's vaccinated. So, because, you've got some conflicting guidance from CDC on this issue. If everybody's fully vaccinated, obviously one of the concerns we have is you start burning through your PPE, particularly for Medicaid facilities. We know there's going to be a surge come fall. We can already see it coming from UK. We obviously want to make sure we're in a position to protect ourselves from any new variants and et cetera, because we just don't know how fast the PPE is going to burn through. So are we able to, is it that you want everybody in a mask regardless of vaccination status, or does the administrator have some discretion to sort of say, if everybody's vaccinated, then this?
Our recommendation has always been you following the CDC guidance.
But CDC's saying two different things here.
I agree with you.
So I think they've got everybody sort of confused on the subject.
We are very confused. So.
And I think, to some extent, and on the one hand.
It's obvious. Now just today they said everybody indoors should be wearing a mask. So it goes day by day. It's
correct. And so, we've actually requested further guidance for assisted living facilities, but, they haven't really, come forward with that.
I can bring that up to Ms. Smoke and see what, if they are going to come out with something, but I know she's going to say that we follow the CDC guidance. Mm-hmm. And at this point, I read it today, they're saying that even if you're vaccinated, if you're indoors, I don't know how Florida is going to react specifically, because I think you have to bring it down to the state and regional level.
Right.
So I know that doesn't answer your question,
I know.
Mark, but
I know.
We all have been wearing masks inside, in the facilities. So whenever that changes, we'll be, bring
I have a question.
Yes.
How does the mask with your residents, what if we know the CDC guidelines, but your residents are vaccinated, but they don't want to wear masks, and then you're looking at resident rights. For instance, my building, my residents don't want to wear masks, some of them do, some of them don't. How do you, if you were surveying walking my building, how would you look at that?
You're putting me in a rough spot, so what I try to do, and as a nurse and as a surveyor, as I look at the bigger picture, I don't just focus in on one person not wearing a mask. You know, you have to do your interviews and you make your observations, and, you know, there are circumstances with every building that is different, but that goes back to the same principle that you try to follow the CDC guidance. You know, we're gonna talk about that in a little bit. One of the citations you're gonna see where residents didn't want it, they just were not complying. So that hopefully will answer, but it, you know, as I said, it will change. Things are they change daily. So it's just to keep, I know it's been so frustrating for all of us. Like, are we on top of it? Are we meeting the guidelines? It's a lot.
I had survey last week, and the interview, part of the interview was it available? Are they offering it to you? You know, how often can you, when the administrator's not there, is it still available?
Right.
So, and I didn't get cited. So
Right.
it was, we had processes in place.
People have rights.
And
But at
because
the
we have
same time,
processes
you know,
and
we have to
systems in
keep other
place.
people safe, so you have to look at your individual, circumstance. I mean,
So they were looking for system and processes.
good. Do healthcare providers dispose of the PPE appropriately, including hand hygiene after disposal? Or, we've become a little complacent, I would say. You know, people, when they take off their masks, or they're taking off their PPE, or they washing their hands and hand sanitizing. So I gotta gear it back up a little bit, sort of. So when I did my presentation, they said, can you just talk a little bit about the infection control part of it, so that people, we keep that sort of fresh in our memory. Do they wear PPE when appropriate with a resident suspected or confirmed? And how do you dispose of it appropriately? So these are all questions to consider. So this is an example of one of the first A30 that was cited when we first started the pandemic. And you can see that when it was based on statement, it said the facility failed to safeguard the residents' well-being to follow the current infection control standards. And that was failure to screen all visitors for the presence of fever and symptoms when entering the building. And that was when it first started. We were sort of in a, some people were doing it, some people weren't. But then this was when the guidelines came down, and the facility was not doing any kind of screening at all. Not asking questions, not doing anything, just letting everybody just come in to the building. So they got cited. This is one of the first examples. All visitors. At that time, we were still allowing visitors. This is another example of a facility that failed to ensure that there was administrative oversight to assess, implement, evaluate, monitor their preparedness for the response to the COVID. And this resulted in an increased risk to the residents and directly affected 7 residents who contracted the virus and resulted in the death of the residents. So again, this was sort of in the beginning part of the pandemic, but I'm just going to give you a few little bit of information that what was not happening. So there was no screening that was happening. So people were the residents and visitors and family and vendors, everybody was just coming into the building. So they weren't following the guidance. They weren't isolating the residents that were tested as positive. So just letting them mingle along with everyone else, including the staff. They weren't monitoring the staff at all. So they weren't asking the staff any questions or to self-monitor their temperature. So there was no oversight at all from a staffing perspective. And as well as the staff weren't using PPE. So they just didn't do anything. So this, unfortunately, example where people ended up passing away. This is an example of a class 1 that was cited last year. And this was a failure to quarantine or isolate 3 COVID positive asymptomatic residents of 21 residents living on a memory care unit. So this sort of addresses what your question was as far as residents that may not be compliant with wearing masks. But in this particular case, I'm gonna go through the whole process of what the surveyor saw or did, and you'll understand. But I have to say that infection prevention strategies to prevent the spread of COVID it's extremely challenging on memory care. We all know that they have memory care units. And you guys do, really do make every attempt to try. Sometimes it's just so exasperating, you just feel like you can't.
So if the facility does not have an ability to isolate a resident, I mean, obviously, and if your policy says, I'm gonna transfer them out, obviously, you're gonna transfer to the hospital and you're gonna transfer out. And then the hospital says, like they are now, all the beds are full, and we want to send them back to you. What then?
What did you do last year? Did you discuss with other locations that had a COVID wing, or dedicated?
I had a call from the deputy secretary at that time and said, Doug, we're gonna have a conversation about some special circumstances and,
Yeah, well,
because there was, but I mean, we weren't set up to do some of the things.
I don't think anybody was really set up, really,
So-
until we just sort of got going, and then, but I think now that we know we've gone through that there's also, sort of the community is, some folks have that opportunity and capability of doing that. So I would just, gotta communicate with each other to see if you can't physically do it, then maybe there's somebody else that you can send your.
Right now, what I'm being told up in Jacksonville, all hospital beds are full. All the special COVID units are all
That's,
full.
something that the secretary and Kim are gonna have to be watching.
Yeah,
Local
so,
skilled nursing should have units, that's what we did, we would just send them to our local skilled nursing that have the COVID unit.
well, we're
And then
being,
keep them to 10 to 14 days and then bring them back and take them back.
You're happy because reimbursement's pretty good.
we're being told right now by Department of Health that all of these special COVID units are all full. Don't even think about sending them out.
There was some appointed by the
I'll give
state.
you names if you need it afterwards.
What's that?
I'm not too SNFs in town, Jackson, I'll take them. Right now, they have 1 beds.
All right, I'm gonna find you.
So, yeah, it is difficult. It's running back. All right, so, this is the beginning of this citation. So it's, during the interview with the facility management, the management was unsure of how many people were actually in the building that were positive. They had no clue.
Oh my gosh. Wow.
I mean, that's something, did we not come in and ask you, like, first thing in the door, like, do you have anybody that's positive? Do you have any staff? How many times did I say that? So this particular individual didn't have any idea, didn't have a list, didn't have. So observation of the memory care unit, the residents' doors that actually had precaution signs on them were left wide open. So in the memory care unit, didn't appear that anyone was trying to isolate those individuals. There was used PPE that was left in the hallways, open red bags, open isolation, infection control bags outside in the hallway with used gowns and masks and whatever else. So this is a memory care unit. Do people wander sometimes in a memory care unit?
All the time.
Yeah. So should have been inside the door. An observation of a resident who was COVID positive was wandering the hallways without a mask and no staff were present. So that person was not being monitored, protected them or others. So And another observation, the same resident was again wandering with no mask. But
Is
the
that
staff,
memory care?
this is memory care, this is memory care. Staff were present, were not observed to redirect the resident. This was positive. So the resident was just wandering around throughout the whole unit with no mask, no direction. Doors are left open, just, you know.
With non-COVID resident?
With non-COVID. Not everybody was COVID, which was a
No unit?
miracle. But there are only 3 of them at this point. So facility staff who were interviewed stated the resident wanders a lot and needs frequent redirection. So staff were observed with only a surgical mask and face shield. So what would you think I would be asking you if I saw that?
Gloves.
Based on what we know now from CDC, if we have a positive resident.
Full PPE. Yeah.
Like what is your policy for a positive resident? What is your expectation for the staff to wear? You know, ask questions. So I'm trying to get you to think like, okay, because we're gonna go back into this. So you can't be just complacent. You gotta think ahead. Like, what did we do? This is what we do. This is what we follow. This is what the staff is supposed to do. So the staff were observed with only a face mask and a shield. So facility nursing staff would float between floors. So they would go floor to floor between the memory care unit that had positive individuals, COVID, into other residents' rooms, and the staff would only wear a surgical mask. So were they being protected?
No.
Were they possibly exposing other people? Because did we know, was the facility even checking to see if the staff were, what symptoms they have? No. So there was all this going on. A med tech on the memory care unit was observed only wearing a surgical mask. So if you're passing meds, do you think you're pretty close to a resident? So that person, ideally, you'll see, ideally should have been wearing additional PPE. So the administrator, when interviewed, she confirmed that the facility policy included to have all COVID-19 residents in their rooms, and the administrator said that they relied on the staff to inform them of, you know, if things were being followed or if there were any concerns. So the administrator was not taking any kind of responsibility, I guess, at that point, relying on staff to inform that person if they were following the policies of the facility. So during multiple observations of staff on memory care, staff were only wearing surgical masks and entering the open doors of the positive residents. We know that, right? So during a meal observation on the memory care unit, the staff were observed to walk from COVID-19 resident room to the hallway and then into another room without disposing of appropriate PPE between residents. So it was just everything, you know, you could sort of see that everything just, the process, if there was one, just fell apart. Now we get into the policies and procedures. That was the, you know, you look at that as well, right? So we reviewed the policies and procedures and we found that all COVID-19 residents were to be isolated in their rooms. Now this is a memory care unit, so it can be a little bit more difficult, but this is what the policy said. And the staff should be using appropriate precautions with every interaction, including hand hygiene and PPE use. So I included this this slide because this is important to know, because obviously we have had so many different kinds of recommendations, but at that time when the citation was written, the CDC guidance included the recommended solid PPE, should be soiled, not solid. PPE should be discarded in a closed container inside the room before exiting. Recommended dedicated staff to work on only memory care units or have consistent personnel so that people weren't floating from place to place. And they recommended implementing a universal use of eye precaution and N95 to address potential exposure to patients or residents that were wandering. Because like we said, not all the residents, they kept taking it off, and but you need to protect your staff and also other residents. So again, this was the recommendation of the CDC. This wasn't at the time of the citation when it was written. This one I could understand would be a little bit difficult for some buildings, but this was a recommendation from the CDC, is that moving residents who are confirmed to a designated care unit to help reduce exposure to other residents and staff. And some facilities did a really good job of that. They actually, I was very impressed. I mean, they did isolate, the memory care, or they moved them to a section of the ALF that they had dedicated staff that were there 24 hours a day, and they just, to get through that period of time, and then they moved them back, because we know that memory care patients, to be in a strange environment and to be so restricted, that sometimes makes their behaviors worse. And so the facilities that did that, they did a really good job to try to really isolate and to contain it so that it didn't get crazy and affect more people. So again, this was the citation that was written as an A Class 1. So you can see it was a sort of just a global sort of failure to really protect the residents. So I would be remiss if I didn't, as I said, if I didn't talk a little bit about infection control. And when they asked me to speak, they said if you could just sort of bring up some basic items, so I'm going to do that. Get on my little soapbox. Infection control, practice reminders, everybody. On average, healthcare providers perform hand hygiene less than half of the time they should. And I don't know if you do any kind of quality assurance or make your own monitoring of people washing hands, but you would be surprised of the folks that do care and they don't wash their hands. And I'm talking from physicians all the way down. So we need to start thinking about that again. When we're washing hands, using hand sanitizer, it does help. It does make a big difference. And are y'all familiar with the 5 moments of hand hygiene? This is important. This I think is interesting. I'm going to read a little bit specific. So first is before patient contact. You're just going to say when do you wash your hands? You clean your hands before touching a patient when approaching the resident. Why? To protect the patient against harmful germs carried on your hands. That's pretty basic. Number 2, before an aseptic task. When? Clean your hands immediately before the task. Why? To protect the resident from harmful germs, including the patient's own germs, entering his or her body. Number 3, after bodily fluid exposure risk. So that means clean your hands immediately after exposed risk to the body fluids and after glove removal. Y'all remember that, right? You put on gloves, you wash your hands, take off the gloves, you wash your hands. After patient-resident contact, clean your hands after touching a patient or his or her immediate surroundings when leaving. And why do we do this? We do this to protect yourself, the staff, and also the environment from, distributing the germs. And the fifth moment of hand hygiene is after contact with patient surroundings. Clean your hands after touching any object or furniture in the patient's immediate surroundings, when leaving, even without touching the patient. Because you don't know what else you've touched, and you're bringing it to so you're protecting, the staff is protecting themselves, and they're also protecting the facility from exposure. So when healthcare providers do not perform hand hygiene 100% of the time, as they should, they put themselves and their patients, residents at risk for serious infection. So I'm going to harp on it and harp on it. So it's between the mask and the hand washing, those are key elements. So if anything, you go back to your facilities, just reinforce that. It does make a difference. It does make a difference. It does protect people. So healthcare providers miss certain parts of their hands when they're using alcohol-based hand sanitizer, because we've all gotten used to just doing this kind of stuff, right? You need to remember to go through between your fingertips, around your thumbs. It's not just good enough to do this kind of stuff, because where are all these other surfaces, right? So these are reminders, right, to help you out to share with your staff. And you want to protect yourself and you protect your residents from potentially dangerous or deadly germs. And just, there is a CDC website which talks about hand hygiene, so I'm bringing that up just because that's a good way for a little quick in-service that you can go right to CDC, and they have all kinds of information.
Is that now the community standard that the agency's using, or is it the FDA guide? They were using like the FDA guide, or referencing the FDA standard as a community standard, or is it now the CDC?
We're looking at the CDC.
Okay, are you? Okay.
That's sort of,
The
we
community.
have to focus on, we can't be having, I look at the CDC, that's what I'm looking at.
Gotcha.
That's your, I think the exact language of how it was described, but that's your gold standard, that's what everybody should be looking at.
Gotcha.
So, that's all I have, it's for you. I sort of told you a little about, remember, about masks and your staff not touching the front of their masks when they're taking them on and off, washing your hands. Y'all sort of been reminded a little bit about what we're looking at when we're coming in. We're starting to do more of the relicensure surveys and complaints. Before we were very focused on just doing infection control and generators, so now the teams are going back in and starting to do some of the relicensure as well. So there are things that they're still going to be looking at. So I know you're going to do great. We're all going to get through this. The next wave, as Doug has said, this wave. But hopefully, we've been through the worst of it.
I think next couple of months will be bad.
Wash hands, wear your mask,
I know.
protect your residents.
Here, you want this one?
Get my name on it. I've got my own in my bag. So, any questions or comments? Thank you very much. Appreciate your attention. Good luck.